Hi, I'm Dr. Mike Bale again. I'm here with Amy Doneen, a nurse practitioner and one of the keynote speakers here at the inaugural meeting for the American Academy of Oral Systemic Health. Amy, thanks so much for being with us.
Thank you. Thank you.
And what Amy and Brad, the other speaker and partner with Amy, are doing is cutting edge on prevention and risk for heart disease, stroke, and diabetes. And tell us about this, what you've done and the history and what you can do and how that's different from the current model now and how dentists can be involved in this and help their patients and themselves.
Right. Well, about 10 years ago when we were focused in family practice, we quickly realized that there were a lot of people who either had obvious risk factors or the lack of obvious risk factors. And by risk factors, I mean blood pressure changes, lipid changes, increased waist measurements, things that the current paradigm is set upon. And that, I mean, we are offered treatment based on a percentage of risk burden, in a sense.
With the current physician world out there.
Correct. The current medical community is based on a risk factor paradigm.
Right.
What we also struggled with early on was that risk was often misleading. And so there were people that had obvious risk factors and yet did not transpire to have events in their lifetime, meaning heart attacks or ischemic strokes.
And vice versa.
And vice versa is true.
Right.
So we started to look differently at the body system and think what actually causes an atherothrombotic event. And we realized early on, and the research supports, that it's really plaque driven within the arterial wall, and that plaque presentation can lead to a clinical event. And the brunkst of an event or not in the presence of plaque is really driven by inflammation. So our focus is, one, take an individual, regardless of their age, their gender, their body size, their risk factors, and ask a simple question: do you have disease in the vessel wall or not? So we use a plethora of different tests that are non-invasive, no exposure to radiation, to simply look at the vessel wall and look for the presence of atherosclerosis. So with that opportunity then to look at the wall of the artery, we can then make an assumption. We can say you have disease or you do not, and we look at as many vascular beds as we possibly can to make that decision.
Non-invasively.
Non-invasively, no exposure to radiation.
And yet this is as accurate or more accurate than some of the invasive procedures?
Well, it depends. The invasive procedures look at lumen diameter, so they look at the opening of the vessel. And yes, it is true that if you have a lumen diameter change, then yes, there's probably a problem and there's plaque in the artery wall, but we want to catch people far earlier than that.
Before that.
Correct.
Okay.
So once atherosclerosis is identified within the artery, we then claim that individual to be somebody with atherosclerosis. And our next question immediately is why? Why is it there? It's not a normal stage of aging, contrary to popular belief. Not everyone has plaque. So if we can
identify... That was incredible for me to learn. I figured it was just...
It's not a normal stage of aging. It happens to be very common. It kills more people than any other disease state out there. But it is not a normal stage of aging and should never be considered acceptable to have plaque in the artery wall. So once plaque is identified, we look for the root cause of why plaque is there. So the most common cause of plaque presentation is a condition called insulin resistance, which we've heard a lot about today. And insulin resistance can also lead to type 2 diabetes. And there's other root causes as well. There's abnormal lipid genetics called lipoprotein A, there's something called myeloperoxidase, there are lots of other reasons plaque is presented in the arterial wall. We identify that root cause and then we go after it and we actually treat that root cause.
And the good news is there's a lot you can do about it.
It's treatable.
You can catch it early and then you can do a lot about it.
It's very preventable and it's very treatable. And the other thing that we monitor probably the most frequently on all of our patients is a very frequent assessment of the arterial wall inflammatory process. So there are a lot of very accessible, cost-effective tests that can be done regularly that look at the health of the arterial wall, both the top layer called the endothelium, we refer to that as the tennis court, or deeper within the artery wall called the intima media. And these tests give us a very clean insight to say, is treatment adequate or not? Is the disease inflamed or is it not? And when we see the inflammation come down, that's when we can feel more confident that we can prevent a plaque rupture and a subsequent autoimmune thrombotic event. And remember, heart attacks and ischemic strokes are caused by plaque that can rupture through the artery wall, or the artery wall erodes, and the body's natural response is to send in clotting factors to heal that ruptured endothelium. When we started to really look at this disease state called atherosclerosis and look at the health of the arteries, the data kept coming back to the idea that periodontal activity and the world of dentistry was really treading on our territory, and we realized clearly that we didn't know enough about that end of it, that if left unaddressed, we were kind of fighting this forever journey. So we have been in an educational process to get ourselves educated and to network then with the dental community, and that's how we met Dr. Tom Neighbors, who had done a lot of work on the genetic interleukin 1 genetic pathway that certainly predisposes an individual to autoimmune inflammatory states. And then looking at the oral DNA, looking at the pathogen presentation within the gum line that can cause vascular inflammation. And that's where we got really fired up, because a pathogen-driven presentation is very understandable to the medical world, right? We understand that. And we like the idea of being able to treat the pathogen along with networking with the dentist with the biofilm removal and all of that end of it, to set our patients up for success for a lack of systemic inflammation. So that's how we met.
The oral inflammation is one of the main causes, or a significant cause, of overall vascular inflammation in the body.
Correct.
Dr. Lloyd Rudy, who famous cardiac surgeon, discovered that it was a thrombus that created heart attacks and strokes, spoke and tells us that of 1,000 valve replacements that he's done, all but one were due to a dental infection.
Correct. Remarkable, isn't it?
Incredible.
Yeah, it's incredible.
So the tie is there, and it's indisputable.
It's time that the medical community and the world of dentistry come together and treat the body as one, because most atherothrombotic events are inflammatory in nature. And if we can treat, whether it be the bacteria that's causing the inflammation, that's also causing gum loss, and we also treat these other root causes of vascular disease, we can really allow people to live well, because that's really what we all want, right? We won't want to live forever, but we want to live well while we're here. And
and longer.
And longer, you bet. The idea of recidivistic events is really something that can be addressed clearly when we bring the dental community into this, because the dental community has the opportunity to see patients very frequently and demonstrate a visual inflammatory process, and therein lies the opportunity to network.
Now tell us about the dental office and how we can actually get involved with this and bring this practically into our office.
Sure. A lot of it's awareness. What we want to do is we want to bring the medical community to be aware that the dental community has impact on systemic health, and there seems to be a lack of communication between the two, and a fairly decent chasm right now, and our intent is to literally bridge that gap and allow a communication process. So what the medical community needs to do is appreciate the dental side, and the dental community needs to realize that they have a key role in keeping our patients healthy. Without the dental expertise and the dental medical end of this, we that treat vascular wellness are challenged. So it really is a respect from one demographic of medical providers to another, and you can't have optimal health without both.
And the dentist can help educate their local physicians about this.
And educate the patients. That's what it's really all about. If a dentist or a dental hygienist has the opportunity to sit with a patient for 20 to 30 minutes and talk about how what's going on at the gum line has systemic impact for heart attack, stroke, and diabetes, then that communication has been initiated, there's acknowledgement of the two specialties, and a network of relationships can start to occur. And that's what I've done locally in my community, and it's been a wonderful journey.
Great. Now, how do we get in touch with you for more information, either for ourselves to learn more about our own health with this cutting edge information and prevention and therapy, or to help our patients who are interested get in touch with you?
Right. We have a website, and it's BaleDoneen.com. That's B-A-L-E Doneen, D-O-N-E-E-N.com. And on our website, we
there's no hyphen or anything. It's
there's no hyphen, no capitals. And our intent there on the website is twofold. One, to provide patient education, provider education, to provide resources to our educational seminars that we give, and also at the same time to provide patients who live in different areas of the country to find providers who are specialized in heart attack, stroke, diabetes prevention through the Bale Doneen Method. So it's really a goal of ours to allow that website to be a platform of education both for the healthcare consumer and the provider.
And the provider, wonderful. Are there any last things that you'd like to tell us before we close here, Amy?
Yeah, there is. I mean, it's an honor to be here. It's such an honor to be invited by the dental world to say, please help us understand the link that we have, and please celebrate the fact that we all are starting to get it. We're learning, the dental community is learning, and we're all learning together to really optimize health of the patient, and that is such an honor to be involved in. So thank you so much.
Oh, wonderful.
Thank you.
And thank you, Amy. It's so great to have you here.
Well, we're very excited. We're very excited.
Amy, thanks so much for being with us today.
Thank you.